So CVS stands for chorionic villus sampling. It is also a needle procedure like the amniocentesis, but it can be done earlier in pregnancy. Typically 9 to 14 weeks is the window of time when a CVS is done. And it samples some cells from the early placenta. If a couple is already decided they do want to have a more definitive diagnosis and do invasive testing, they may opt to do CVS because you have a result sooner. CVS and amniocentesis these days both test for chromosomes, but there's also an array of other disorders that can now be tested for. And one of the hard parts for couples to decide in some cases is whether to do these expanded tests or not, because those results can be somewhat confusing in terms of what the information is. If they're all negative, you feel great. If some of these are positive, we're not quite sure in every case what that really means for your baby. It does seem that in the most experienced hands, the risk for CVS is probably the same as the risk for amniocentesis, but generally speaking, the risk for CVS is quoted to be a little bit higher than the risk for amniocentesis. Technically, it probably relates to people who have done many more amnios and less CVSs. Much like the amniocentesis, a needle is inserted. That is like drawing blood, is not so comfortable, but it's typically brief and patients often tolerate it quite well. CVS is mostly done abdominally, although there are sometimes, depending on the location of the placenta, sometimes it may also be done vaginally. And so the needle is introduced under ultrasound guidance, and a sample is taken from the site of the early placenta. We often tell patients to expect to wait somewhere in the 10 to 14 day range. For chromosome analysis, results are 100% accurate.